It is both a virtue and a principle. But as a principle, it broadly requires that we act in ways that are loyal. Okay? Loyal. This includes keeping our promises, doing what is expected of us, and performing our duties and being trustworthy. All right? So if you read Beauchamp or Beauchamp, whatever, however you want to pronounce the name, he included, including Childress, he included the word faithful. Actually, he prefers faithful more than loyal. And I would agree with him that faithful has a deeper meaning because our relationship with our patient is a fiduciary relationship. It is similar to a husband and wife relationship that is based on trust. Okay. So I would prefer the word loyal. If you are faithful, if you are, yes, loyal, you are somehow following the principle of fidelity. Now, it's as have been mentioned, this is a strict observance of promises or duties. But it's not only the responsibility of the doctor. This principle, as well as other principles, should be honored by both provider and client because it's a relationship. To whom are you going to be faithful? To whom are you going to be loyal? To your patient. But the same manner, your patient also has to have that loyalty and fidelity to his or her relationship with the healthcare provider. Now, if there is mistrust, if there is disagreement, then there is an option for the patient to terminate that relationship. Okay, the same thing with the doctor because if it's not an emergency, you can actually choose your patient. But if you end the relationship, it must be something that must be agreed upon by both parties so that the relationship will not be damaged. It can still be there whenever and wherever the patient would like to be your patient again. And if ever you would like to accept your patient as your patient once again. Okay? So it must be something that is mutual. So what are the expectations in principle of fidelity? You must treat, okay, your patient with basic respect. That you, the caregiver, or other healthcare professionals are competent and capable of performing the duties required of your professional role, and that you adhere to a professional code of ethics. So you need to you need to be respectful of your patient, you need to follow professional code of ethics, and you need to hone your skills and your knowledge because you need to be competent. All right. And in following the code of ethics, it means that you have to follow policies and procedures of your organization and applicable laws. And more importantly, honor your agreements with your patient. May it be something that was written through informed consent or something that was verbalized only. That would still be an agreement. However, fidelity is perhaps the most common source of ethical conflict. The conflict is between what they believe is right, meaning what your patient believes is right, what the patient wants, what other members of the healthcare team expect, what organizational policy dictates, and or what the profession or the law requires. All right? It is between all these issues that there can be a conflict because there could be differences in opinion. So if you are confronted with conflicts of fidelity, okay, involving your patient and yourself or others, you have to remind yourself of these two statements. Professional effaces self-interest in any conflict with the patient's interest. So if there is a conflict between the patient's interest and your own personal interests, you have to remember that your patient's interest must be your primary consideration. So you need to avoid conflict of interest. All right? As much as possible, you need to avoid those things. that would put your patient at risk. All right. So when there is conflict naman between your patient and others, for example, patient's interest should take priority over other interests. So others means which would mean your friends, your family, your work, all right? Other organizations, for example, another medical school, for example. So if there is a conflict of interest between the patient and the others, again, the priority would still be your patient. Kaya mahirap siya. Okay? Because sometimes the conflict is between your patient and your family. So sinong uunahin mo? Okay? Between your patient and your friends, sinong uunahin mo? So principle of fidelity dictates that we give priority to your patient, to our patients. So problem, the fidelity to patient versus allegiance to colleagues, institutions, funding agencies, corporations, or the state. Okay, so let's take a look at these different situations where there is an involvement of another person. Okay, so we call this the third party interest. It says here, third party in this context is another individual or group of individuals. So you have a patient and there's another person. Okay, example, in a child-parental relations in cases of Jehovah's Witness who refuse blood transfusion for the child. All right. So in this particular situation, who is your index patient? The child or the parents? The child or the parents? Who is your index patient? Anybody? I hope all of you are listening and not just there. Yes, Gail. All right. So who is the third party? What is the conflict?
Bawal pong mag-transfuse ng blood for Jehovah's Witness po.
Yes, bawal. So paano siya magiging conflict? Iho.
Dahil po bawal, kapag hindi po kasi mag-transfusion, pwede pong mamatay yung patient. Parang ganun.
Eh bakit hindi mo na lang i-transfuse? Halimbawa, kasi pasyente mo naman is yung bata. Ano yung conflict? Diba? Alam mo na kailangan niya yung blood. Life-saving yung blood. Diba? Ba't hindi mo na lang ibigay? Ano yung problema? Kadukoy. You are on the right track eh. I'm just rephrasing. Yes.
Dahil po wala pong consent ng parent.
Right, walang consent. Yun yung interest ng third party. Madali mo sanang magamot yung pasyente mo, kaya lang the person who's going to give the informed consent cannot give the consent and therefore you need the surrogate. And those are the parents. The problem is the parents would not like to give the consent. So sino ngayon ang susundin mo? Yung parents who do not want to give the consent or your oath of duty to the child that you can save the child if you give the blood transfusion. So yun na yun. So meron ka ng conflict involving the third party interest. So what are we going to do? So according to AMA, this is what we need to do. A physician has a fundamental responsibility to the patient even if a third party establishes the initial contract for services. This loyalty to the patient should almost never be yielded when loyalties become divided, even if a court order must be obtained to authorize surgery, blood transfusion, or the like. to that extent you need to do it, all right, in order to save your patient. All right? Ibig sabihin, it's only the court that can override the refusal of the parents to give the consent. Okay? So medyo mahirap dahil aabot ka pa sa korte. In other countries, probably this can be done fast enough, no? But here in our country, it's so difficult to do this. But in principle, that must be done. All right? Another one is a maternal-fetal relations, such as in the case of Angela Carter. Angela Carter is a patient who is pregnant, but at the same time has a medical problem. Okay? So the attending physicians, the obstetrician and the pediatricians, okay, think that they can save the baby. So they now ask for an informed consent from Angela Carter to operate on her by cesarean section. Kasi hindi pa kabuanan eh. So hindi pa nagko-contract, di ba? But they can save the baby if they do cesarean section. Angela Carter refused the cesarean section. So the attending physicians now sought a court order in order to override Angela Carter's decision because they want to save the unborn child, the unborn baby or the unborn fetus. Okay, so for the interest of the unborn child, the court granted permission to the attending physicians to perform cesarean section. Okay, so in this particular case, who is the index patient and who is the third party? Anyone? Isip-isip. Exam na next week. So who is the third party? Who is the index patient? Anyone? Ako, paano kaya kayo sa exam nito? It's either you don't know or you are not there. Nakapark lang kayo.
Doc, si Angela.
Sino
Not
si
sure.
Angela? Ano siya?
Mother po.
Index or third party?
Index po.
Okay, siya yung index patient. And who is the third party this time? Sige Jen, you're on the right track. Sinong third party?
Yung baby po. Hindi po kasi
Correct.
dinig.
Totoo, tama ka. So, baligtad ngayon yung scenario. Yung unborn child ngayon, yung third party mo. Alam mo, basta involve ang minor, especially to mga unborn child, talagang who would protect the interest of the child? It's the state. Okay? Because they cannot give consent, they cannot voice their concerns. No? So, there would always be a challenge to save their and to protect their interests. Unfortunately, in this particular case, Angela Carter, the mother, would not like to give the consent, no? Kaya na in-override siya ng attending physician nila through a court order. Again, unfortunately, the outcome of this case, both mother and child died after the operation. Okay? Kaya ni-review ito ng korte kung tama ba talaga yung naging decision nila to override the patient's autonomous wish. No? So, well, in cases like this, mahirap talaga, kaya nga umaabot sa korte yan. And you need the wisdom of Solomon. Alam mo yan. You need the wisdom of Solomon to weigh the interests of both parties before giving a decision. And the evidence, science would help in making the decision. And of course, the ethical principles. So these are just some of the examples where a third-party interest is involved. And you have to be reminded of your primary duty to honor your the autonomous wish of your patient. Kaya lang, pag ang involved is ganito mga kaso, no, baka it might be very difficult for you to decide on your own, then you have the option to refer to the Bioethics Committee of the hospital. And in the Bioethics Committee always include a lawyer kasi may kasamang legal implications yan eh. So what might be ethical may not necessarily be legal. So that's what we want to avoid, no? Any form of lawsuit that we might incur with our decision. All right. The other one now, institutional interest. In this particular case, it's not an individual now, but an institution who has a conflict of interest with the patient. It says here the institutions involved often are not healthcare institutions, but to discharge their primary and legitimate functions, they may need medical information about individuals and may provide some care for the individuals. So they are not necessarily a clinic or a hospital, but other organization or institution whose medical history of the patient they need in order to serve their clients. Okay, so these are examples of these are pre-employment medical examination, insurance, and prison. So let's take a look at pre-employment medical examination. I don't know if any of you have worked before, no? So if you are going to be employed, you need to undergo pre-employment medical examination. So what happens in practice is either the applicant pays for his pre-employment medical examination, or it's the company that pays for the pre-employment. It's not much of a problem if it's the applicant who pays for the medical examination, because all the results would be given to him and the results would be discussed to him directly. All right? What is problematic is if it's the company that pays for the pre-employment medical examination, because since they are the payer, okay, the clinic now gives the result directly to the company through the human resource department. Okay, so most of the time, the applicant would not know anymore what the results are. Pag tinawagan siya, ibig sabihin accepted siya. Pag hindi siya tinawagan, pwedeng may problema siya sa medical examination or hindi siya nakapasa sa mga interview. Bahala na siya na mag-isip kung ano yung dahilan at hindi siya tinawag. Okay? What is the problem? The problem here there is the patients wouldn't know whether he is suffering from a medical problem or not. So that is quite unfair. All right? So where is the conflict? You as the attending physician, all right? Your interest is that of the patient, the applicant, kasi siya yung hinistoryan mo, siya yung pinii mo, sa kanya ginawa yung laboratory. So it is but right that you discuss with your patient the results. However, the one paying you is not the patient. It's the company who has a contract with the clinic. And part of the contract is for you to give your evaluation directly to HR. Okay? So yun na yung conflict. Okay? Yung interest ng company versus the interest of the patient. The same thing is true with the insurance company. Ang maganda lang dito sa insurance, dun sa form nila na pagkahaba-haba, kasama na dun yung waiver. Makikita mo na pirmado niya na yung waiver. Na he is allowing you and the clinic to give his medical records to the company. Yan. That he is applying to for an insurance. For an insurance. Yan. May waiver na yun agad. Okay? So, yun yung problematic dito sa dalawang ito. Pero at least sa insurance, may waiver siya. Kaya lang your findings sa ano man yung findings sa labs, hindi mo na madidiscuss sa kanya yan unless pumunta siya uli sa'yo, no? But the findings on PE wise, you can discuss with your patient even for pre-employment. Pwede mo na sabihin agad yan kung ano yung findings mo sa PE. Ang mahirap lang yung sa laboratory results. Alright? So for the prison, dito sa prison, may mga doktor sa prison. Not necessarily as prisoners, but as medical providers, no? Because they have an infirmary in the Bilibid prison. Okay, so conflict lies if you are be called upon to participate in the implementation of capital punishment through lethal injection. Anong magiging problem doon? Kung ikaw ay tawagin para mag-participate sa capital punishment, what will be the problem? What would be the problem there? Anybody? Imagine yourself that you are a government employee and you are the doctor in the Bilibid prison. You are in the infirmary of the Bilibid prison. So your task mainly is to take care of the prisoners, right? But this time around, you are being called upon to participate in the capital punishment, implementation of capital punishment. So may isang prisoner that would undergo lethal injection. Anong magiging conflict doon? Anybody? Or else I will call any one of you.
Doc,
Yes, Philip.
nangako po kasi tayo as physicians na we have the responsibility to save lives or improve it.
Yes.
And pag po ganun yung nangyari, it contradicts what we have promised as oated as doctors, as
Yes.
physicians.
You're right, no? So your role as a doctor is to save lives, no? That is what you have a pledge in your Hippocratic oath. However, in capital punishment, it's the other way around, no? You are being asked to actually implement capital punishment because what will you do as a doctor? You will be the one to clear the patient for the lethal injection, meaning you have to make sure that the patient is healthy. You cannot, it cannot be double dead, you know. You cannot punish a person who is already very ill. So that person must be somehow strong enough. Pangalawa, second, you will be the one to monitor the patient. You will be the one to give the lethal injection, and you will also be the one to pronounce the patient dead. So all those procedures and processes are contrary to your Hippocratic oath. However, you are also an employee of the government. You are being paid a salary, monthly salary, to do your job. So you now have a conflict. Okay? The interest of the institution that needs to carry out capital punishment versus that of the prisoner. Okay? So what are you going to do in cases like this? This is what AMA says. Physician participation in capital punishment through administration of lethal injection is unethical. It is unethical. It may not be illegal if capital punishment is legal in the country, but it is definitely unethical. Okay, so as a doctor, you must declare that you cannot participate if you want to be ethical. But you have to be prepared for the consequences if you decline, because you are being paid. You are a government employee. Yun na yung magiging, that will be now your dilemma. All right? So in this case where there is an institutional interest that is involved, it says here at the minimum, healthcare professionals have a moral responsibility to oppose, avoid, and withdraw from contracts that would require them to withhold information of significant benefits to examinees. Physicians owe due care to individuals who become their patients under a third-party contract in industries, prison, and the armed forces. So in third-party contract are the payers, no? Like the insurance company, the company that your patient is applying to. Okay? So they are the third-party payers. So what we do in practice, we just have to ask or tell the company that we would like to discuss the result of the examination to the patient. All right. So usually naman they would allow that. You will just have to tell the patient to ask when they can when the results would be released so that they can follow up with you. Meaning the clinic would give the result to HR, to their company, and the patient who would come back for follow up would be given also a copy, a Xerox copy of the results. That is if they would like to come back and know the results. All right. So they have that option so that we will not be unfair to the index to the applicant. So third party, in terms of an individual, another if it's an institution, the third one if it's the medical, if it would be the medical students, no? This time for clinical teaching, the third parties in this context are the medical students. Why is this a problem? Why can there be a divided loyalty in this case? Simply because as students, you need patience, right? But you are not yet licensed. So the patients that you see in the hospital or in the clinic are patients of the attending physician, especially in pay hospitals or in the pay ward. Okay, so me, for example, I'm the attending physician. My fidelity is to my patient. However, I am also a faculty and I am obliged to teach my student. And so therefore, I would be sharing now my patients to the students. Okay, so nasan yung conflict? My loyalty to my patient and my loyalty to you as my student. Okay, that's why in private hospitals, rarely would you be able to do physical examination of procedures. Probably you might be allowed to take the history, but some patients also would not like that. In our setting, where because we are known to be a academic institution, the one who's taking the medical history are not the clinical clerks, but the postgraduate interns. Yeah, allowed yung postgraduate interns because they already graduated. It's just that they don't have the license yet. So madali mong ipakilala na doctor din siya. Okay? But of course, supervised by the resident in training. The most that you can do in the pay ward is monitoring. Yan, pwede ina-allow yun. But where you can really practice your medical history taking, physical examination, procedures, that would be in the service ward. Okay? Or in the government hospital. That's why we have a second base hospital, which is the Rizal Medical Center. Because there, the attending physicians are the resident in training and the clinical clerks are allowed to handle cases. Okay? Now, how do we prevent abuse of this patient? No? Kasi sabi dito, justice requires that any burden of participation not be inequitably assigned to poorer and less educated patients. That is true. However, in practice, it's really not possible that the pay patients would allow to be patients of clinical clerks and interns. In reality, it's only the poor who would allow themselves to be your patient. So what do we do to deal with that reality? Informed consent, no? Disclosure of patient involvement, respect the privacy and confidentiality of the patient. So what we do in practice, if we have patients to be for admission in the service ward and government hospitals as well, they are informed that there are medical students who would be doing history taking and physical examination and some procedures also. All right, for them. It has to be disclosed in the informed consent. Now, even if that is the case, even if they have given the consent, it has been our experience that during the course in the ward, some patients would withdraw their consent, meaning they would they would refuse to cooperate, like they would not like to answer interviews, they wouldn't like students not to do procedures. So even if they have given their consent before, we do allow them, we do allow the refusal. We respect that particular their decision to refuse. It's their right still, even if they have given the consent initially. You cannot blame them because there are so many students, group of students who would come and interview the same patient. So in the long run, really, the patient will be harmed if we insist. That's why if they say no more, then we respect that decision. That's why it's very important that you have a rotation in government hospitals because there are really many patients, and the patient will not suffer from repeated interviews from the same group of clerks, from different groups of clerks. Okay, so that's how we do it in practice. Now we do have preceptorship for clinical clerks, preceptorship with our pay patient as far as the department is concerned, no? And that's allowed, no, by the hospital. So but only in our department we do have that preceptorship. But we ask the patient if it's okay to have a medical clerk with me, ganyan. Papakilala mo, ganyan. Pag pumayag siya, do the clinical clerk would stay. And most of the time naman, this paying patient allows the clinical clerk to stay. Now, conflict of interest. So this time around, the conflict is between you and the patient. So a conflict of interest is a situation in which a person is entrusted with the interest of a client, dependent, or the public tends to be unduly influenced by a secondary interest. You now have your personal stake in this conflict. And the secondary interest may be of financial nature, but it may also consist of personal prestige or academic recognition and promotion. But more often than not, the conflict of interest involves financial nature or money. Okay, if you are getting a certain amount of money to perform a particular procedure, for example, or research, okay, and your patient is also your research participant, that is a conflict of interest. There is nothing inherently unethical in finding oneself in a conflict of interest. Rather, the key questions are whether one recognizes the conflict and how one deals with it. Okay, so it is not necessarily unethical and it is not necessarily illegal. However, if you can avoid situations where there can be conflict of interest, you try to avoid it. Now, if you are not able to avoid it, meaning you have found yourself already in a situation where there is interest, then the best thing that you should do is manage the conflict. All right? Why do you need to manage this conflict of interest? Because patients might suffer physical harm. And your judgment, the integrity of your medical judgment might be compromised. No? Because you might be motivated not by the best interest of the patient, but by what you gain out of it. And therefore, it may undermine trust in the medical profession. Now, what are the examples of this conflict of interest? The fee for service reimbursement. The physicians and healthcare institutions can increase their revenue by providing more service. Fee for service, this is not it's not out of pocket kasi patients will not have to pay it's the insurance who would pay you. Many of our patients, mostly 90% of our patients are health card holders. They have health insurance. That's why they have this, they do go to the clinic frequently, and to clinics or hospitals that are somehow pay, because they have the card. Otherwise, we won't have much patient. There are very few paying patients na out of pocket. Most of them are health card holders. That's why you would often see patients that would demand that they be admitted even if they need not be admitted. There are patients who would demand for procedures, for symptoms, even if they are not yet needed. Like they would demand CT scan, they would demand ECG, they would demand all these laboratory workups because they have a card. Okay? Not simple as that, because you need to seek approval for the request. All right? Now, if they have the card, you would see more patients, right? You would see them more frequently, and there is that, but there is a possibility that you would perform more interventions, and you would request more laboratory procedures because they have the card. So if you will not be strict enough to follow what is recommended as far as clinical practice guidelines, you might be tempted just to give in to your patient's request. And if you give in to your patient's request, it means that there would be more patients who would like you, and therefore more patients who would seek consult with you. All right? And that would mean income for you and for the clinic if you have ancillary services in the clinic. All right? So that's the problem there. So sample situation, managed care. Example, health maintenance organization. There are a lot of these existing multi-specialty clinics which are accredited by health insurance. Even for the hospitals, no? There are HMO accredited. Most of the hospitals are accredited by HMO. So at a minimum, fidelity to patient requires efforts to meet the patient's needs as completely as possible within the guidelines, as well as disclosure to the patient of why a potentially useful diagnostic or therapeutic procedure is not being provided. So your basis for the decision whether your patient is to be admitted or not, or whether a particular laboratory should be done or not, it would be what the patient needs, and not what the patient requests from you. Your only motivation should be what is best for the patient as recommended by the clinical practice guidelines, and not just to be pleasant to your patient. Now, if the guideline says you need to, then you would request kasi kailangan niya. But if it says that hindi pa, there's no need for it yet at this point in time, then you have to explain to the patient why. Now, many patients there are difficult patients. They are not easy to deal with. So if they really insist, then the most that you can do is request it, and then just tell to the patient that it's up to the health insurance whether they are going to approve it or not. Remember, for approval, you need to have a diagnosis. Sometimes what they want cannot be explained by the diagnosis. So there's the conflict. All right? Pwedeng hindi pa kasi kailangan eh. And then, if the patient insists, you might be forced to place in your diagnosis a wrong diagnosis, just so the request would be approved. Yeah, and I am very strict about it. I am very honest with my patient. I cannot lie. I cannot tell that I'm suspecting TB just so we can have the chest X-ray done. I cannot I cannot put in the diagnosis that you are hypertensive just so we can have this blood chemistry done. All right? But I'll tell them I would still request for it, but it's up to the HMO if they are going to approve it or not. Meron nga well adult but they need the whole gamut of this laboratory. Well adult ka nga wala kang diagnosis. So that's for screening. So what you want is an executive checkup, then have a schedule for executive checkup. It is pre-approved and it is based on what you are paying for in the card. So you have to explain to your patient in a manner that is compassionate, and therefore they would agree with you. If not, then let the HMO handle the situation. Now, another one is self-referral by physicians. Referral of patient to medical facilities or services that physicians themselves own or in which they have a financial investment. Okay, so again, it is being practiced because this is not considered illegal, but you would find yourself really in a conflictual situation if you refer your patient to a facility where you have an investment. Why? Because you stand to gain from that referral. All right. So payment to physicians for referring a patient is considered fee splitting or a kickback. In other countries, this is illegal. So what are the examples of these? Physicians owns or incorporator of the hospital. Very common to among the secondary hospitals. Like if you live in Quezon City, like Diliman Doctors, Commonwealth, Fairview Gen, all those secondary hospitals, the incorporator there, actually, the owner of those hospitals are group of physicians. You can be an investor. You buy shares of stock, so it's allowed. And you can also practice there, but you need to pay another amount of money in order to practice. So there is the right to invest and the right to practice. Magkaiba yun. Okay? So if you are a stockholder, you are an incorporator, and therefore you have dividends. Okay? So there would be possible conflict of interest there. Now, if you are a dispensing physician, meaning you sell medicines to your patient, or you have a pharmacy beside you that dispenses your prescription, then that is a possible conflict of interest again, because you stand to gain from the prescriptions. No? Your choice of medicines might be influenced by what is available in your pharmacy or by what is available in your medicine cabinet. No? Especially if we have deals with the drug company regarding your orders, no? Meron yan may mga perks yan when you order a certain volume of medicines, no? So those things can influence your decisions. So that's why it's a conflict of interest. Some physicians not only dispense standard medicines, they also are engaged in networking. So many of these networking products are multivitamins and beauty products. No? I have seen some physicians involved in this, and part of their dispensing is the product of these networking companies. Okay, so please, it's not so good, no? If you sell these products to your patients, because patients would have difficulty to say no. And then when you get percentage for laboratory referral, a 10% usually for referring patient. So this one in other countries is illegal. This one in other countries is also illegal. But for us, these are all being practiced in our country. But please try to avoid because there would be conflict of interest. Now, AMA says that self-referral might undermine the commitment of physician to professionalism. In other countries, they have this, they call it joint ventures, and it's for them, it is illegal. It is illegal for physicians to refer Medicare or Medicaid patients for ancillary services, such as for ancillary laboratory tests to facilitate the facilities in which they have financial interest. So they are very clear on this. No? It is illegal. What is the exception? What is the exception? In-office ancillary services, group practice, rural areas, and services personally performed or supervised by another physician in the same group practice. Okay? So what you're going to see in practice are mostly multi-specialty clinics. So pag nagpunta kayo sa mga mall, all right, or in big hospitals, what you would see are multi-specialty clinics. And in those clinics, there are in-office ancillary services like simple laboratory like blood chem, CBC, urine, stool. They also have X-ray machines, ECG, 2D echo for some. Okay, so those are multi-specialty clinics with in-office ancillary services. So in other words, the referral is among themselves. All right? And the referral for laboratory procedures is also in that particular clinic. And most of these clinics are accredited also by health maintenance organization. That is legal and that is ethical. Okay? This in-office service in multi-specialty clinic is different from referral to outside facilities in which the physician has a financial interest. What we have previously discussed, no? That this in-office services is different from this one. And the in-office services is also different from this one. Kickbacks physicians receive for simply referring a patient for service. Because in a multi-specialty clinic, you don't get paid for referring. Of course, you should not get a referral fee, no? Even among yourselves in a multi-specialty clinic. That is not being done there, okay? And we don't refer to outside facilities if the in-office service is available in that particular facility. Although it is allowed, okay, sabi dito, although there are no legal prohibitions on physicians referring patients to ancillary services in their office or clinic, there are ethical concerns, no, about overutilization of services and poor quality of care. As I have mentioned, they are also accredited by HMO. So there is also that temptation to overutilize the card so that you would have more patients in the clinic and therefore overutilization of services. Okay? And if your clinic does not practice standard of care for the facilities, for the maintenance of the facilities like the echo machine, ECG machine, laboratory machines, X-ray machines, no? If you do not follow the standard of care for those for maintenance, that would now result to poor quality of care. All right? So sometimes you would doubt results. That's why if we do get patients coming from these small laboratories or small clinics, we tend to repeat the procedure because we sometimes doubt the quality. So physicians have an ethical obligation to set up equipment and services in their offices only if there is demonstrated need and if they have training and experiences to carry out or supervise the services. So if you are in a city like Manila or Quezon City, and there are a lot of laboratories around, then why don't you just refer your patient there for laboratory rather than maintaining your own lab? Okay, especially if you don't have a licensed med tech, pinapadala mo din lang naman sa ibang laboratory, then rather have that laboratory procedure done by an accredited laboratory. Just don't get a referral fee for doing so. Okay? So if you do not have the training, if you lack the money to maintain the facility, then probably refrain from having those services in your clinic. But if you are in a place where there are no laboratories around, very few hospitals, or the medical facilities are quite far from the clinic, from the community that you are serving, then by all means, you can have it with you. You can have them with you, those services. But please maintain them as much as possible. Recommendation in general, physicians should not refer patients to healthcare facility outside their office practice at which they do not actually provide care or services when they have an investment interest in that facility. All right? The prohibition of self-referral, allowing exceptions for disclosure when self-referral is necessary because of lack of other facilities or services, is the most appropriate expression to patient. All right? Avoidance of self-referral should not be considered an option, but rather a firm obligation of fidelity and a necessary condition of moral integrity. So how should you avoid conflict of interest? Reaffirm that the patient's interests are paramount. You need to remind yourself of that repeatedly. Incentive should not induce physician to forego what is clearly in the patient's interest. Disclosed conflicts of interest. Actually, disclosure is the golden rule in conflict of interest, meaning that's how you manage conflict of interest. That's why if you would look at the journals, no, when you read articles, you would see their disclaimer or you would see their disclosure, because the investigator and the authors should disclose whether the research was funded or not. Okay. Now, if you are listening to webinars, you would also see there part of the presentation of the speaker is the disclosure whether he or she is being paid for by the company that sponsored the webinar, right? You need to disclose. Okay. So that physicians might prevent physicians and organizations from making an unacceptable arrangement, and patients might make more informed decision. The problem is in clinical practice, especially if you are an investor. I don't think doctors are disclosing to their patient that they have an investment in that particular hospital. Mahirap mong ma-expect for doctors to tell the patients that one. Okay. So manage the situation to protect patients. Additional step beyond disclosure, well, in ethics, we do ethics review so that we can protect the interests of the participants, especially if the investigator is also the attending physician. All right? May ganong instances. They need to declare in the informed consent that the doctor is also at the same time the principal researcher. So double yung purpose ng kanyang pag-consult as a patient and as a research participant. Okay? You try to prohibit actions like sponsorship of drug companies. You try to avoid that, no? But in your second year, we will have a discussion on Mexico principle. Hindi naman siya talagang bawal, but there are some limitations. Okay. So these are the references for this particular topic. Okay, do you have any questions? So please, the group reporters, kindly share your slide now.